Today we'll discuss about low back pain. As you all know, almost 60 to 80% people experience low back pain during their lifetime, with its prevalence slightly more common in female than males. So what is low back pain? In simple language, I would say low back pain is a common disorder that involves muscles, nerves and bones of the back. It may be classified by duration as acute, subchronic and chronic. Back pain can range from mild muscle aching to stabbing, shooting or burning sensation and radius down your leg. Most back pain gradually improves with home exercises and self-care, but you have to take medical advice when it persists for few weeks, months or more, and not improving with rest, and it causes weakness, numbness or tingling sensation, and if there is fever, and if there is urinary incontinence or loss of control of bowel movements, and weight loss follows by a fall or trauma.
Back pain can cause functional limitations in your life. It can affect your career and even affect your mental health when it persists for a long period of time. Many people will remember a specific event when right before their back pain commence that normally wouldn't hurt the back, such as a sneeze, but after a long-term loading, this sneeze can be enough to aggravate the tissue pain. So when you visit your physiotherapist, he or she may help you find out the root cause of your pain, and he or she may provide you with the treatment interventions which include exercise therapy, electrotherapy, manual therapy and much more, and also gives advice on how to get back to your activity. And also the exercises that you should continue doing at your home so that your back pain will not come again, or you can prevent this from coming back.
Let us see what are the major causes of back pain or low back ache. There are numerous causes for back pain. Among these, the most common is the injury or trauma to the vertebral column or the structures that supports vertebral column. It can be injury to the bone itself or muscles or ligaments. Okay, let us first look at the structure of your lower back. Our spinal column is made up of 24 vertebrae. Back problems and back pain commonly occur in the lumbar region. Each vertebrae has an opening that forms the spinal column and protects the spinal nerves. Facet joints and intervertebral discs connect the vertebrae above and below. These structures are held together by groups of ligaments and muscles. Muscles attached to the spinal column allow us to move, and they also support the spine, bearing the body's weight. If some of these muscles are tight, weak or imbalanced, pressure can result in excessive wear and tear of other structures. For example, a common problem in the lower back is disc herniation. In this case, pressure on an intervertebral disc has caused its center, that's the nucleus pulposus, to protrude backwards and push against the spinal nerves, resulting in low back pain. For some patients, this pain can also be felt in nearby areas where the spinal nerves runs down. Okay. That condition is also termed as sciatica. At Maurya Center for Physiotherapy and Ayurveda, we follow a special protocol, an integrated protocol combining both Ayurvedic treatment and physiotherapy, along with dietary regulations, herbal internal medications, yoga therapy, and also home exercises. Ayurvedic treatment or Indian herbal treatment is one among the best treatment for low back pain. This includes two stages of treatment basically. In the initial stage, we aim at reducing the pain and inflammation. Here we didn't use any oils, we use only dry herbal powders or paste and steaming like that. In the second stage, we use oils and other medicines. In this stage, we aim at stabilize and strengthen the muscles of back and to reduce the pain this way. In initial stage, we start with podikidi. It reduces the inflammation and pain. Along with that, we can do labana with specially prepared medicines just applying the special medicines over the painful area. This also helps to reduce inflammation and pain. After labor, steaming to be done to relax the muscles, to relax the tension muscle. Full body steaming also effective in back pain. Kadivasti, a treatment method which helps to reduce pain and strengthen muscles, is done over the affected area. Abhyanga, massage with warm oil, warm medicated oil, that also helps to release the spasm of muscles, to reduce pain, to give relaxation to the muscles. The next stage of treatment is electricity, which is very effective in relieving back pain. It helps to strengthen the muscles and reduce the inflammation deep inside. Bandage on the lumbar area with specially prepared medicated oils will help to reduce the pain and keep the spinal muscle stable and strong.
When you approach to a physical therapist, the first thing he will do is thorough physical assessment. As a part of this, he will ask you about the pain, how and when it is started, and the duration and the nature of the pain. Because pain is the warning sign of a living body. So every pain has a reason behind it. By taking the history of your pain, the physiotherapist could understand what is the cause of that pain. Then your physiotherapist will ask you to do some movements. After that, he will make you to move in a certain way of movements. That is called special test. Along with this, he will examine your spine, your joints, your muscles, and other soft tissues also. By this physical test, your physiotherapist could understand where it originates the pain, where it comes from. Whether it is from your bone, whether it is from your muscles or your ligaments, like that. Sometimes films like MRI, CT and X-ray also be suggested. But also people having without low back pain also show some changes in their MRIs or films such as disc herniation, disc prolapse or age-related degenerative changes, like that. So correlation with films and physical examination report is very important for effective treatment. Otherwise, the treatment may be misleading. Once the assessment part is complete, he will make you a better treatment plan for you.
After a thorough examination, the physiotherapist will plan the treatment. The assessment will include special tests and some diagnostic techniques like X-ray and MRI. The treatment will vary from individual to individual. It depends on the condition of the patient. The treatment includes stretching to lengthen the shortened muscles. Strengthening exercises to improve the muscle power. Spinal mobilization to improve the mobility of the spine. Myofascial release technique to reduce the tightness of the fascia. Spinal manipulation technique to improve the mobility. Trigger releasing technique to reduce pain. Dry needling technique to reduce pain. conventional methods like ultrasound therapy, interferential therapy, exercise for core muscle stabilization, lumbar traction to improve the intervertebral space. A reassessment will be taken after a week to see the progress and to change the treatment protocol. Home exercise programs will be taught after the completion of treatment. It includes stretching of the tightened muscles and some strengthening exercises.